Welcome to my show. Today I am going to share a story of one of my students that's in my hand exam prep program. Her name is Nicole, and she is an occupational therapist, and I just wanted to share her story and how she's working, how she has been practicing occupational therapy for years and decided, okay, this is the time I really want to work on specializing. And then of course COVID hit, right? So listen to her story and see how she's not only persevering in her career, but helping other people in her area and in her setting where she works to help them be successful too, no matter what's going on. I always say that if you've got your skills and you're determined, no matter what's going on, you're still going to make it and you're still going to be really successful. So listen to her story. I'm really glad to share her how inspirational she can be. So welcome, Nicole.
All right, well, Nicole, I am so excited to have you on my Hoang show. I still don't have a real name for this show, except for I spoke to Carrie a couple, I think 2 weeks ago when we were coming up with cheesy names for my show. But the purpose of this show is really just to showcase and share different therapists all over. Whether they just want to share their stories just like yours, or I'll have different experts in here in their area that they're really good in and share different tips and advice for people so they can learn and implement things right away. So one of the reasons why I wanted to talk to you is you're in my hand exam prep program, and I know that you've been a therapist for a long time, and I thought, and then especially with this COVID, we've had several different conversations on how you've kind of had to show up as the therapist and as like really the leading therapist, you know, in your institution. So I wanted to bring you on and just talk to you a little bit. So why don't you introduce yourself to everybody? Now, you guys be nice. This is Nicole's first time doing anything like this. So once I post it, you guys have to bombard this video with like positive things about how brave Nicole is. So when I first talked to you, Nicole, you were like, I don't know if I could do this. I'm not tech savvy. I don't have a computer. You're doing this off of your iPad, right?
Yeah.
You've done this whole part off your iPad. So kudos to you. Ooh, Nicole. Going from like, you're like, I don't know if I can do this, to, dude, you're like doing a live Zoom interview. So I think that's pretty awesome. So, you know, everyone's going to be watching you. Don't be nervous. I'm not saying to make you nervous.
For sure, in that one.
I know. No, but your story is going to affect so many people, and you're going to encourage people, and I think that's the amazing part. So go ahead, Nicole. Tell us a little bit more about you, where you live, where you work.
I live in northern New Jersey, pretty much 15 minutes outside of New York City. Presently, I'm working with a hospital network, but a specific hospital, which is right outside of New York. I've been an occupational therapist for a little over 24 years now. And that was, I call my midlife crisis in my late 20s, because I had started in the mental health field out of college, and it was working in mental health that I learned about occupational therapy.
Really? So this is almost like your second career?
Sort of, yeah. I don't know. I mean, I always make a joke, at 27, I had a midlife crisis and went back to school and became an OT, so, but I mean, healthcare has been in my family. My father was a physical therapist until he was disabled at a very young age. So,
okay, wow.
So it was like I kind of learned a bit of certain things, but through journey in mental health, I learned about occupational therapy, and I went, I like that.
Yeah.
So
that was mine too. That was mine too. I, in high school, got exposed to mental health and worked in a lockdown psychiatric hospital for one of my internships, and I was drawn to occupational therapy through the mental health aspect.
Yes, I was in a lockdown unit as well, and then
You sure we weren't working together?
And then I worked with adults, outside, mental health center. And then I pursued OT. And as I was going through the education, I went, I like the phys phys aspect of this. And even as a student, I said, I want to get that CHT. I want to get that CHT. When I graduated, I worked in another hospital, which was interesting. I was able to have an exposure to both subacute rehab, long-term, acute care hospital, and outpatient. So I had a nice flavor of everything there. But as I got older, it's a little rougher to pick up the patients. And I was like, I'd like to really focus on hand therapy, and mainly because it's a challenge. It was a challenge. It's so intricate and so detailed, and there's a lot there. And it's like, it really challenged me as a person and as a therapist. And that's why I started focusing and then made my way to where I'm at now.
Good for you. Yeah.
So I work in an acute care hospital we have a very big outpatient department. And so, when you look at a hospital's, outpatient departments, I would consider ours was pretty large. So I saw the majority of my time during the day was spent with outpatients, and then part of my day then would go inpatient to see the acute care patients as well.
Yeah. Most big systems have acute care hospital, and then those acute care patients go into a rehab, and then they also have an outpatient too. Is that how yours is set up? When I used to work for a big system, and most of the big systems where I work, it's acute care, and they could go to rehab or they can go to outpatient. They can go rehab outpatient or they can go outpatient, but there's the whole big umbrella of rehab. It's acute care, inpatient, rehab, and then outpatient.
There is that levels, but of where I work, it's like we're not connected. You could be working with patients, and they're like, okay, they're going to be given like 5 or 6 names of subacute rehab facilities they can go to, and then from there they go there. Now, whether they come back to us, that's another avenue that brings them to us.
Sure. Okay. So you started going more and more into outpatient.
Yes.
Okay.
Yeah.
How is that?
Yeah.
What's been going on with that?
As of late,
yeah.
It got very interesting. So it was kind of, we started hearing the word COVID in December and January, and we're going, okay, what does that mean for all of us? By February, it started getting a little like, this is getting a little close to home, and even patients were starting to verbalize, like, how safe are we? What's going on? And I know like that last week of February, first week of March, patients were verbalizing to us that family members didn't want them coming to the hospital for therapy because there's COVID over there. And so there was a lot of fear happening with our population. And so we were starting to like give them, okay, so here's some home exercise programs, and we were really, while we're very much like, you need to attend, we were kind of starting to lax that because there was such a fear factor happening.
Sure.
But then by like that first week of March, second week of March, the hospital deemed it's time to stop. They had stopped all volunteers, all visitors to the hospitals.
Yeah.
Student programs were shut down. I had to force students leave our program, and our patient systems were pretty much closed down.
Well, you were still able to continue working for the most part because of your vast experience. Like, you're not just an outpatient, right?
Right. So we were, as a rehab department, there were a lot of conversations were had, but we were then redeployed into different parts of the hospital. So what was good about being still that therapist of working as an inpatient therapist, you're not going into unknown territory. So the nurses, the docs, the system of the hospital, but we definitely took on varying roles to assist what was going on in the hospital. So some therapists were, like myself, were deployed onto the floor. So like I was definitely going between 1 or 2 floors in helping the nursing staff, the CNAs, whatever had to happen.
Yeah.
Some therapists were deployed into helping with the storeroom and making sure stocks were getting out onto the floors, because everybody's heard, we're running low on PPEs. That happened to us too. And one weekend I became like the police officer, like, what do you want? How are you going to use it? You're not shutting it up.
You can't be don't be taking this home. Yeah.
You had to. You had
Yeah.
to be really tight, because it got really, really thin. Things got thin.
Yeah. For sure.
But it was a scary time. It was an exciting time.
Yeah.
We learned
you really
a
stepped
lot.
up though. You really stepped up though, like Nicole. You really should give yourself some credit, because I feel like when people were fearful, you were able to use your experience, and like you have a very strong mindset of like not letting certain things stop you, right? Like you already have this mindset. Do you realize that? Or you're like, just me, I just do whatever.
Well, truthfully, that's what I was saying, because I'm not comfortable with taking compliments. I'll be honest. And
It's me a long time. It's practice.
I had my director come to me and say to me, you realize people are very grateful for what you're doing on the floor. And I said, look, I see a need. This is what I do when I jump in. I know, but I'm going to be honest with you. When it started, I was scared. I was like, oh my gosh, this is real. We've lost a couple of people from the hospital system in just my hospital to this disease.
Right. Yeah.
You sit there and you go, what could happen to me? I mean, we had a few of our therapists get sick. Thank God they came back. They're back at working, but it's a scary thing, but it's funny. I was talking to a friend of mine and I said, I'm not running from this fight. I will not run from this fight.
Yeah.
And
you didn't let the fear stop you. You didn't let the fear stop you. That's exactly,
Yeah. And they just said, promise me you will take care of yourself. So with that, my own network of friends, whether they were working in hospitals or not, they would like take that phone call from me going, I just saw this. This is like, wow, I'm exhausted. When is this going to stop? But when I walked into work, when I walk into that patient room, hey, how's it going? Have a good morning. And it was like, because my thinking, and this is a thought that I've always had as a therapist, whether it's on the front lines like this, or even, when things are normal as things can be, is, listen, that could be me sitting in that chair as a patient. How do I want to be treated? Right. And that has always been in the back of my mind. Sure. This is something I tell all my students, how do I want to be treated if I'm the patient? And so I don't want some cranky person working on me or walking into my room, when I'm feeling like garbage. I want someone who's going to be up. And that's what I did.
Yeah. That's someone who's putting their stuff aside to think of you. Like, so what you're doing here is you're putting someone else's needs ahead of your own, not in an unsafe way. We can come into these situations in a safe way, but putting their needs ahead of your own, in the sense that you want to, whatever time you have with them, give them the best possible experience, to be able to help them. Right. Yeah. Yeah. Well, good for you. I'm glad that you do have that mindset, because I think that a lot of people need leaders like that. You are someone who's worked in OT for a long time, and you've worked in different areas for a long time. And I think that people do look up to someone like you who can show that type of strength. And it's not even the number of years. It's really the mindset of like thinking about someone else, putting aside that fear. You can be fearful. Like, we're all fearful, right? It's what we do with that fear that determines what happens next, but this is not the first time you've done something like this. You've shown, like, we've spoken about your journey to becoming a certified hand therapist and some of the adversities I think that you've come across, right? I mean, a lot of people say that it's hard to get into the realm of hand therapy, and it can be. It's equally as hard to pass the certified hand therapy exam.
it's been, and that's been a rocky road for me, I'm a person where, people have said, you kind of can't do that. You're not going to be good at that. And then I turn around and go, really? Watch me. And that's kind of how I've always been. And, it's a struggle. Learning, like, I'm a hands-on person. I'm not a book person. So I learn and I do a lot better than read a book, read that chapter, taking an exam. That's my battle. And so I have sat for the CHT a few times and miss it by points. And you sit there going like, ugh.
I know, it burns, but it burns real deep. But you have picked up and taken it again. And I think there's a lot of people who've taken it once and then like given up, or you haven't.
I'm a person, I'm a very diverse personality, I can tell you that. And
you're determined.
I am. I'll be honest with you, I did kind of step away from it for a little while, and I said I need to just live my life. And in living my life, I've had some personal losses in regards to some friendships, with illnesses and family illnesses and things like that. And and I said, okay, that had to be done. But I started last summer thinking, like, I never threw away my books. I never threw away my notes. And as I shared with you earlier, my wall of insanity behind me.
I love it.
That's just the beginning.
Yeah.
And I never threw away all those notes that are now plastered across my bedroom wall, because I walk by and I go, oh yes, I have to remember that. Oh yes, I have to remember that. And I went, I got to do this again. And I started that journey of studying last October. And then, I had a friend of mine who was like, I'm going to be on that journey with you. Well, yes, she had to drop off that journey. And then, be honest with you, somebody on a Facebook chat brought your name up. And that is how I connected into your program. I'm like, what is this? Because people keep saying having a mentor is key. And that's one thing I hadn't had in the past, is someone to walk the journey with, because as crowded as North Jersey is, it's very hard to have someone mentor you. And it's hard to find a hand therapist, because there's not a lot out there.
Yeah.
So I really looked at, I followed you, and then you had that day that you sat and talked with us all. And
the kickoff call?
The kickoff call.
The kickoff call. Oh my God, my daughter was there. Did you see the video? I looked back at that the other day, and she was like mimicking me. And I was like, this little girl.
But that was when I went, I got to do this. And that's when I signed up.
That's
and
awesome.
It's history ever since.
So how has this program helped you? Well,
two things.
First of all, has it helped you? You can be honest.
Two things. Because it was during one of our calls that you helped me with my injury from the car accident.
Yes.
And it's funny because I used that injury to help study the hands, because it really, like, as I'm talking to the doctor and she's telling me what's going on in my hand, I went, I know this, and then we're discussing those tendons and those structures at the same time. Yeah. And I'm going, oh, and another aspect of it is I started looking at some of my, I picked up practice exams in the past, and I have them all, so I didn't throw anything out. And as I started to look through those questions, my mindset changed, because I can get tripped up on questions quickly.
Yeah.
And you were saying, don't look at it this way, look at it that way. So I started to look at the questions a different way. And as I went through a practice set, I did a lot better than I had done in the past. And I went, oh, I think this is working. So that's why.
That's awesome. Yeah, it's so much about the exam. It's very specific, right? Wouldn't you say, in how you study? So everyone who has joined the program has joined for lots of different reasons. But the one main reason why they wanted to join was the overall thing that I've heard from everyone in the program has been accountability.
Absolutely.
And that's a really huge thing, because when we are in school, we're held accountable to turning in papers, to doing certain things to get a grade. But once you're out of OT school, there's no accountability anymore. Everything, your whole life has been all about accountability. And then you graduate and then there's no accountability at all.
Absolutely. And the thing is that, you know, our lives get busy, you know, like,
Yeah.
how many directions can you get pulled in? You know,
Yes.
you know, you got your family pulling you, you got your job pulling you, you've got personal, you know, things you like to do pulling you. But, you know, we have to show up once a week. Well, when we were doing it once a week, we have to show up once a week and have that conversation. And, you know, granted, when the COVID crisis hit, it became really hard focus for me to study. But showing up weekly and still having that conversation kept a normality to it. Yeah. And then even when we heard the exam was canceled and now moved to November, while it ripped me apart, I was just like, are you kidding me? You know, but you know what? The classes keep you focused. And it was interesting because last week we had our class and we were working on carpal tunnel, and that's probably, I cracked the book. I was a good girl. I cracked the book. And, you know, and I had given myself a little time to just breathe, but now we're heading into a new month and I'm going, guess what? Now it's time to start to really be more focused in on what we're doing. But I left that call going, I really miss hand therapy. And so the next day I had seen my director. While we're still trying to create this new normal, we're starting to try to get our outpatient caseloads back up and running and places to go, because where we were, my place was turned into another ICU. So we have to find a new space for us. Yeah. I saw my director and she's like, how's it going? And I said, I'm sad. I miss being an OT. I want to be an OT again. Yeah. And things are moving now in the right direction in regards to getting us back open and running again. And really, like, the books are back out, the papers are back out, the insanity is back up. And, you know, it's time to focus, because my goal is November. I want to do this. I want it done. I want to get it.
Yeah. And I think that I'm kind of glad the test was canceled after the fact, right? Like, while it was being canceled, we were all really hurt, because I have such an invested interest in every student that I help, that I want them to get what they want, which are those 3 letters, CHT, right? I want to help them. But the most important part, outside of the service, I want everyone to feel really confident going into it, right? When you feel confident going into it, no matter what the outcome, you're going to feel good about yourself, right? That the sting, absolutely. It'll be a sting if it doesn't happen, but it won't be as bad, just because you came into that like with a certain level of confidence, like you did a lot, versus like, oh, I'm not ready, I don't feel prepared, I don't feel confident about it. You know, there's a different mindset when you go into it, and I don't think anyone would have been in the right mindset going in it at the beginning of May, especially with everything that was going on.
As disappointed as I was that it got canceled, it was really a blessing, because there's no way I could have done it.
You could have had your mind in. No. Right?
No.
After the fact, after I had time to think about it, I was like, you know what? I think it was a really good thing, because now we get to calm down a little bit. And we've been in the Bridge program, which bridges from the one series of 3 months to the next series of 3 months. And we can still stay on track. We don't have to go as hardcore as we were, but we were able to stay on track.
And stay focused.
Focused, even if you did a little bit. My biggest thing is habits, and you have to keep doing it no matter how little you're doing it. As long as you're just doing a little bit at a time, you'll stay focused. right?
And also the big thing is that taking what, like, again, we were just talking about complex regional syndrome. It's got it right over here.
Yeah.
Like I was like, we were thinking about that, and we, you know, just started having conversations with coworkers out of the blue of certain things, you know, and then I think at one point we were talking about carpal tunnel and nursing coming up to me, Nicole, you guys open yet? I have so much pain. Well, guess what? Talk to me. What's going on? And doing it right there in the hallway of like, what can we do to help ease your pain? Because, you know, there was a lot of physical work that had to happen over these 3 months, you know, and so, you know, I might not have my outside patients, but you know what, I got my coworkers in the hospital who need help. And so, and they taking what we were studying and bringing that to the table for them.
Yeah, absolutely. Letting them know that there are options outside of surgery and that there's possibility. Everyone wants that possibility to be able to get better, right? And you can talk to them now. When I worked in a big hospital, a lot of those people became my patients, not just in the hallway. Not everyone wants to be your patient in the hallway. I'm going to tell you this right now, Nicole. Not everyone wants to be a patient in the hallway. Some of those people that you're talking to will want to come in once you're set up and ready to go. Don't forget them. They need to come in to see you in a formal setting, you know.
Well, I say that to them. I said, when I have my office, I said, I know where you work, and I will come and get you straight back over there.
Right, exactly.
You know, so
yeah, for sure.
Absolutely.
Well, I'm excited. I'm excited to keep going with you, and I'm excited for November. I want to definitely make the most use of our time still going forward. What would you say to people who are kind of like on the fence for this type of program?
Definitely worth doing this journey. You hear from not only your expertise, but you also hear from your peers that, you know, it's wild to be talking to all these people from all over the country, okay? And hearing what they're doing and how they're handling it. And you sit there and you're going, oh, wow, I didn't really think of approaching that particular clinical condition from that angle or that avenue. And really, you keep us focused, because the big thing that I've learned is that where this is maybe not such a positive of being a therapist out there for so many years, because when it comes to taking the exam, you keep telling us what's in the books. And, you know, I can't think of Mr. A or Mrs. B like, well, this is how I handle these conditions. No, what does the book say? So you're helping me kind of get rid of some of that clutter of my work history to stay focused. Go back to the basic, go back to the foundation of our practice.
Right. Yeah.
Where do we build off of that foundation to become therapists? Like, so what is back on the foundation? So you kind of reel us back in and focus us to where our brains have to be in regards to going towards the test.
Yeah. It's about the critical thinking and decision making. So critical thinking and then decision making process in the test that will get you those letters. Then you take that same critical thinking and decision making process to your patients. So when you are with your patients, there's a lot of different things to do that are right. There's a lot of things to do that are right, but you're going to do X first, Y second, you know what I mean? But on the test, there's only one right answer. Can only be one right answer. And that critical thinking and decision-making process is huge when you want to pass the exam. And I think you're right. People do think about, you know, people who have been in the field for a long time do get it a little muddy. I know that when I've had friends have taken it in the past, the conversations were always, well, I don't do it this way. I do, well, you're not fucking giving the test out. Like, someone else is giving the test. You got to follow what they're doing.
You know, and when you've given us, okay, this is what we're going to study for this week, and these are the chapters, you're going through those chapters with us. You're sitting
Girl.
there, book to book, chapter to chapter. I see that notebook come up. I see that book come up when you're writing notes for us.
Oh my God.
So like
Chapter papers.
you are walking through the chapters with us. So it's not like, okay, just do that and I'll catch you on next Tuesday. No, you continue the journey with us.
I'm
But
reading
also,
them suckers.
you know, like at any time that I have a question, I know I can email you and you'll, I'm not going to get a rapid response. I know it. You're working, I'm working. But, when you get that time, you're going to either email me back or you're going to bring it up in that call. So there's a constant dialogue. But what about this? But what about this? And then you're going like, that's good, but you want to go this way. Or, oh, I didn't think of it that way. Let's look into this a little further. So like you really help with the problem solving and with the studying and with really just the search and the seeking and which way, how do we have to put our brains to be focused on this while we're still got everything else going on in our lives behind us.
I had someone talk to me about age before and talking about somehow they have to become a CHT by a certain age. And I think that you really defy that. I don't agree with the age thing at all. I think you can get it at any age. It's like how bad you want it or where
That's
you want.
really, age is nothing. I think people talk about age because they say, when you're younger, it's easier to take a test. And maybe it would have been like that for me. I don't know. But like I said, I've always struggled with exams, no matter what age I was. It's a goal. Okay, it's a goal. All right. I'm going to be honest. I'm 55 years old. I get it. But it's a goal that I've wanted since I've been in my 30s. And I'm not going to let go of that, But what do you like? But what is your goal? Why do you just want to get those 3 letters? Then that's not a good goal. The goal is like, do you want to get those 3 letters and to be a better therapist because of those 3 letters? That's your goal.
Thank you, Nicole, for saying that. I love it. It is. I said like studying for the exam, like made me a better therapist, made me think more, made me dive into more of like how can I best help somebody else versus the letters.
I'll tell you this one story. I was at a class, the continuing ed course, and they proudly wear the badge. They have a CHT, and I was talking about an age gap. She was a much younger therapist than me, and here we are, and she got she got it, and we're now discussing stuff on the wrist, okay? And she couldn't figure out where the radius was. And I went, what? She's like, because we're supposed to now place the goniometer and we're looking at how to range the wrist. And she's like, is this the radius? Or is this, she didn't know where it was. And I looked at her and I said, how did you get that? How did you pass that exam if you do not know where your radius is? So like, it's not about just passing the test. It's like, what are you learning from it in the journey to pass the test? Like for me, I learned stuff and I can bring it into my clinic to help my patients. Okay. It's not about, I got this new prize. I got this new piece of paper. I got this, whatever. What are you using it for? How are you making yourself better as a therapist to help the people that are going to come into your clinic?
Yeah. And Nicole, you also get to help so many students who look up to you,
Yeah. I run,
a lot of people.
I bring in the students for both, not only the occupational therapy department, but also physical therapy, and I assist speech therapists. So I guess they call me a clinical coordinator is the best title to have.
You're the educational coordinator. You're the educational coordinator.
Yeah. So I will, try to make the best fit for student to therapist, but then I just don't let it go. It's like, I'm always at that student going, how's it going? How's things going? What are you learning? Is there anything here that's like scaring you? Is there anything you have questions, you ask me? I don't care if you're a student of OT, PT, or speech. You
Right.
see something, you have a question, you ask. That is why you're here. You're here to learn, because when you go out in the field, you're going to be working with a lot of different people out there. So
Yeah.
how are you going to be able to interact? And this
Yeah.
is the process of, this is how you interact with therapists. This is how you interact with nursing, with doctors, with secretaries, with housekeeping. This is how you interact, you
Yeah.
know, and
Yeah.
that's a thing that I do with the student program. Yeah.
Oh, that's so awesome. Well, I really appreciate you sharing your story and inviting more and more OTs to listen and get inspired from everything that you're doing, from mindset to, you know, your journey to becoming a CHT. It's really awesome. Now, you also had a ton of questions for me, right? You want to ask some?
And a few, you know.
I'm an
So
open book, man.
How
What
did,
do you
why
want
did
to know?
you want to become an OT? Why did you want to be an OT?
Why did I want to be an OT? I wanted to work in mental health, actually. I was in between psychology and OT. And I thought I kind of wanted to do research stuff. You know, you kind of always in college sort of get drawn into that. And anyway, I've always been involved in OT from like my hours in college, in high school. I used to observe OTs. I don't know why, but when I did hospital volunteering, I saw more of the OTs. When I worked in the psych hospital, I was with rec therapists and I saw OTs. And then when I was in college, I went and worked in a hand therapy clinic and I observed, you know, CHTs, OTs, CHTs. And I just thought it was like really cool how they were so creative. And there's a huge psychology component to working with patients, especially hand patients, hand and upper extremity patients. There's a huge psychology component, especially from a surgical standpoint. And yeah, that's always interested me. And then I really liked how technical hand therapy is. There's a lot of intricate things. It's, you know, complex. And so those things intrigued me. So that's how I got into OT and then into hands. But I did the same route that you did, which is I worked in skilled nursing. I did hospital work for a long time. And the only peds experience I have is in NICU. So when I talk about raising your hands to do the things you want to do, like NICU babies can have brachial plexus, can have different congenital hand stuff, but also NICU is also the specialty thing too, right? So I've always kind of been drawn into that. And from an early on, my experience was early on in wound care. And so I did a lot of that stuff, but in acute care was where I got a lot of my upper extremity experience. And when somebody was like, well, who wants to learn more about NICU? And I'm like, I want to learn more about NICU. I want to do it. So I took a class, did NICU, and one of the hardest splints I ever made was in the NICU to a preemie baby. That was the hardest. I mean, girl, I was sweating. When I tell you I was sweating, and that splint took me an hour and a half. It takes me 10 minutes to make a splint. And I was straight sweating. Like I was there forever. I was like, this poor baby. Like I felt so bad for him. But I did NICU, and then from NICU, you did developmental clinic. So you'd follow up with these babies every like 3 months, 6 months, 9 months, up to a year. So that's pretty much my peds experience, but all related to NICU. And then I got into hand, you know, therapy afterwards. And then from big institutional type of hospital, I went into a small private practice. And then from there, I went into my own private practice.
Oh, so you probably learned a lot being in that private practice to then know how to open up your own private practice.
I learned what I didn't want.
There you go. And that's learning.
I learned you learn what you want, and also make sure you learn what you don't want. You know, I wanted to work in a very certain way. I wanted to, I mean, I see it now, you know, there are certain expectations that were expected, but weren't clearly defined. And then you can only play so many roles
roles when you, like now I play lots of roles, right? As a business owner, I play lots of roles, but when you're hired for one role but expected to play two roles, it's kind of different. It's kind of difficult. So I was expected to see lots of patients at a time, which I actually really good time management, and I have like great skills for seeing a lot of people at the same time, but making them feel like I am got eyes only for them. So it's a skill that not everyone has, but I do really well with it. But then they weren't really running their business very well, and so then there was a lot of expectations on me to do certain things that I wasn't trained for, essentially. Like I just didn't know. One of them is marketing. When people talk to me about marketing, you have to understand what kind of marketing they're talking about. I'm actually currently hiring a marketing assistant in my company. And I have to ask that because people will say stuff, but you have to understand what they're saying. So what's your current understanding of what that means, what marketing means? And it's funny because that one word can mean so many different things to so many people. Just like, what are you hired for as, an occupational therapist? Well, their understanding of what they're hired to do could be different from what your understanding of why you hired somebody, right? So you always have to learn their understanding so you can know, like, where am I at? Where are you at? So that we're making sure we're at the same place and having the right kind of conversation. So, there was a lot of frustration because, I couldn't do two jobs. I couldn't do them well. Right? Because I had absolutely no structure, no focus. But yeah, so after I was there for a while, and I loved the people that I worked with, and I worked with a surgeon, and he's great. I always speak well of him. He does great surgeries and stuff like that. But it was difficult because it wasn't his own. It's a long, complicated story, but yeah, you couldn't be effective. So in the end, I was like, okay, I'm ready to step out and do my own thing. And that's what I did.
That's very cool. Because it can be overwhelming when you see that, like, how do people do that? Like I opening up your own practice. Like, how do you do that?
A lot of fucking work. That's all I can say. It's a lot of work. When I was working, I was then going home and learning what I needed to do as a business. Nowadays, everything's online nowadays, right? I mean, tons of things are online. It's just about finding out which programs fit for you. But like when I started 6.5, 7 years ago, there wasn't as much, not to say that there wasn't any, but there wasn't as much. I just didn't know which ones. I didn't even hear about. I thought you just opened up your clinic because other people did that. So a lot of times you'll watch other people, right, to see how they do it, thinking that you can do the same thing. So I watched people and they were like, oh, well, you just rent a space, you market this way and that way to a doctor, and then you get patients. It doesn't work that like it kind of works that way. You can get started that way, but you can't keep going that way. Yeah. That's the biggest thing, is that you can get started one way, but you can't keep going that same way. And I would tie my story back to your story. You got started to study for a CHT many times, however many times you did it, but you realized you couldn't keep going the same way that you were going. You needed to get help. So that was me too. Like I started a certain way, and then at some point very early on, I was like, I can't keep doing it this way, looking at people. I need to get real business skills. And so I invested in myself yet again and got, training and mentorship and coaching and different business skills, because you can be a therapist and you can have everything wrapped around your skills, right? Well, being a business owner is a whole different set of skills that is different. They're very similar if you start to dissect it all, There's certain things, critical thinking, decision making, it's the same. I don't care where you go. I don't care what you're doing, but they're relatively the same no matter what. But you've got to make decisions. But you have to have a certain know-how so that you can critically think through your problems. You just have to know what those problems are so you can come up with a solution. Otherwise, you're just like, I don't know. You know, your brain asks you questions that it already knows answers to. So then if you're not asking the right questions, you're never going to get the right answers, you know? So yeah, I had to do a lot of, so I went out on my own 6.5 years ago, and I was like, I'll just work for myself. Didn't work like that. So, but I always knew in the back of my head that I wanted to help other therapists. It was always a dream of mine. It just didn't know how it's going to happen, when it was going to happen. And then when I started to open up my own practice, and I was having a really hard time hiring therapists that had the skills that I need. And so I knew that I needed to make hand therapy secrets come to life faster.
But it's good because there's no avenue out there. This is really the first time I'm seeing this stuff, which is like, where was this a few years back?
Yeah.
You know?
Yeah. It wasn't
So
there. It was in my head, Nicole. It was in my head. I was dreaming of it. I didn't know how to make it happen. And then now I made it happen. And you'll see, like, there's more and more programs once, you know, stuff, but I would say that I'm really huge into making this the best experience, you know, very targeted towards like what people need, how people need it. So I would say that, you know, like if I always think of you in mind, or the next student in mind, if I always think of the other person in mind, then I'm going to be in a better position to help them, which I think you do the same thing. You do it from a therapist perspective. I do it from a therapy perspective in my clinic. I'm taking what I'm doing in my clinic and applying it to therapists. That's all I'm doing.
You just made it broader now by going, you know.
Well, you know, it's really incredible. I've been talking to a lot of therapists. People are emailing me. People are scheduling to book a call with me from all over, all over the world. You know, I'm talking to people in different countries I never thought I would talk to, like, to be honest. And they say the same things. I want to pass. I want to become the CHT. I want to be the first CHT in my region or my area. Man, we have the ability to, positively affect a lot of people, so that then they too can affect all the people around them,
It's that ripple effect when you throw the stone into the pond.
I think that, from the first time we talked to now, I definitely see an increased level of confidence in you that I didn't see before, because you're doing new things that you hadn't done before. And I bet you anything that ripples through all the people who come into contact with you and the students you have impact. So it's a big deal, to kind of have like this kind of platform nowadays that we didn't have 10 years ago.
Yeah.
So I really thank you for coming on and talking to me and sharing your stories. And I will see you on one of our calls.
Absolutely. Thank you for inviting me.